If your knees hurt every time you walk, go upstairs, or stand up from a chair. You are not alone. Millions of adults over 50 struggle with knee pain every single day, and most people are told the same thing. It's just aging. Your joints are wearing out. You'll have to live with it. But what if the real cause of your knee pain is not actually your knee? What if the pain is coming from something hidden, something most people never think about? Because today, we're going to uncover the hidden cause of knee pain nobody talks about, and why fixing the real problem may help your knees feel stronger, more stable, and less painful. And some of these causes may surprise you. So stay with me. When people feel knee pain, they naturally focus on the knee itself. But the body doesn't work in isolation. Everything is connected. Your hips, your ankles, your muscles, your nerves, even your posture, all affect the pressure placed on your knees every single day. And one of the biggest hidden causes of knee pain is actually weak leg muscles, especially the muscles in the thighs and glutes. These muscles act like shock absorbers for the knees. When they are strong, they help support your body weight properly. But when they become weak, the knees are forced to handle more stress than they were designed for. And over time, that extra pressure creates pain, stiffness, swelling, and inflammation. This is incredibly common after 60 because muscle loss accelerates with age. In fact, many adults slowly lose muscle mass every decade after middle age without even realizing it. And the less active you become, the faster those muscles weaken. This creates a dangerous cycle. Knee pain makes movement harder, so people move less. Moving less weakens muscles, and weaker muscles create even more knee pain. But that's only part of the story. Now let's talk about another hidden cause most people completely ignore: tight hips. Yes, your hips may be contributing to your knee pain. When the hips become stiff or weak, your walking pattern changes. Your knees start moving in unnatural ways, pressure shifts unevenly across the joint, and certain areas of the knee become overloaded. This is one reason some people feel knee pain more on one side than the other. And modern lifestyles make this problem worse. Too much sitting tightens the hips and weakens the glutes. Over time, the body loses mobility and stability, and the knees often pay the price. Now here's something even more surprising. Poor ankle mobility can also contribute to knee pain. Most people never think about their ankles, but if your ankles become stiff, your knees are forced to compensate every time you walk, bend, or climb stairs. Imagine trying to squat while your ankles can barely move. The knees end up absorbing extra strain. And over months or years, that strain builds up. This is why knee pain is often a full-body movement problem, not just a knee problem. Now let's discuss inflammation, because chronic inflammation silently damages joints over time. Inflammation can increase due to poor diet, lack of movement, excess body weight, high sugar intake, poor sleep, and chronic stress. And when inflammation rises, the knees often become swollen, stiff, warm, and painful. Many people notice this especially in the morning or after sitting for long periods. Now here's another hidden issue nobody talks about: weak feet. Your feet are your foundation. If the feet are unstable, the knees above them become unstable too. Flat feet, poor footwear, or weak foot muscles can change how pressure travels through the legs, and that may slowly increase knee stress over time. This is why some people notice knee pain improves simply by wearing better supportive shoes. Now let's talk about what you can start doing to help your knees naturally. First, gentle movement. Many people stop moving because of pain, but complete inactivity often makes stiffness even worse. Movement helps lubricate the joints and improve circulation. Simple walking, light stretching, or chair exercises may help keep the knees moving. Now here's an important exercise many physical therapists recommend: straight leg raises. Sit or lie down comfortably. Keep one leg straight and slowly lift it a few inches. Hold briefly, then lower slowly. This helps strengthen the thigh muscles without placing heavy pressure on the knees. Another helpful movement: sit to stands. Simply practice standing up slowly from a chair and sitting back down with control. This strengthens the muscles that support daily movement. And here's something very important: weight management matters. Even small amounts of extra body weight place significant additional stress on the knees during walking. That doesn't mean perfection is required, but reducing strain on the joints may help relieve pressure over time. Now let's discuss warning signs you should never ignore. If you experience severe swelling, locking of the knee, sudden instability, inability to bear weight, or intense pain, you should speak with a healthcare professional. Sometimes knee pain may involve arthritis, meniscus injuries, ligament problems, or nerve-related conditions, so never ignore worsening symptoms. But here's the encouraging part. Many people believe knee pain automatically means their best years are over. That is not always true. The body can often improve when you improve movement, strength, circulation, and stability. And small daily habits matter more than most people realize. A few minutes of gentle movement every day can be more powerful than staying inactive for months. The key is consistency, not perfection, because the goal is not becoming an athlete. The goal is protecting your mobility, walking comfortably, standing confidently, living independently. And the sooner you address the hidden causes behind knee pain, the better chance you have of staying active later in life. So if your knees have been hurting lately, don't just focus on the pain itself. Pay attention to the muscles, the hips, the ankles, the feet, and the way your body moves as a whole. Because sometimes the real problem is hidden far away from the knee itself. And fixing that hidden problem may be exactly what your body has been needing all along. If you found this video helpful, subscribe for more simple health and mobility tips designed especially for adults over 50 and seniors. And remember, movement is one of the most powerful gifts you can give your body as you age.